Hi friends, how are you doing? I'm Solomon and I'm professional in health. So my background is public health. Now currently I'm working in Oromia region, Sagar subsidy as what we call dynamic clinic. So you see, you can read from there. I'm working around 14,000 per month. That's net. What I what I pay for. So the work is really exhausting, but in our country, the burden for living is high. So you know, but reciprocally, so the due payments by government and private institution is slightly low. It's much low, so it's highly low. You could say we barely receive payment for our service. So because 14,000 means when we change 14,000 into dollars. So I can calculate, please. So 40,000 into okay. I paid $70 per month. You know, that's really it's not payment. So you can say we are working for freely. So because the payment we receive is not that much important. So we do such work because we don't have options. So if you are from a poor family, so from low income family, you don't have enough money to open an institution for yourself or private organizations. If I would have enough money, I may have some clinic for myself, some private clinics, I like full like you know but that's why it seems hard. And currently also I decided to learn medicine. I said previously that I'm graduate from Magala University and also graduate in public health. So I have around 4 years of experience in healthcare systems, including research settings and clinical settings. So, but the payment is low. You cannot afford living with this payment. So, also, a lot of things. There's a lot of things you can see here in our country, and I'm feeling currently I'm working like freely without any payment because these payments couldn't afford my living conditions. So being working without any payments is not that much important. So I decided to take another course for to be a medical doctor. So we call it new initiative. So new initiative medicals educations. It's given for those of basic holders in our country. So basic holders in healthcare. It takes up to 4 years, I think. So you know, takes up to 4 years. So I'm glad to join there and to learn more. So but I know that learning medicine or being a medical doctor is it's not to mean it's about getting or payments about getting a good payments, because if even if you are a medical doctor, you would have a payment of around 16 or 19,000 birds, 19,000 bird a month. So 19,000 means around like 180. I'll calculate it. Sucks. Around $118. So so it's obviously this mean to those doctors who are hired by government, they're going to pay $118 per month. So it is hard to live with 180 with a salary of 180. So it's hard to live with this payment. So you don't have choice. So many of medical doctors are working by receiving this amount of money from especially government. If they are hired private, so they may got like 40 or 50,000 per month. That means around 300. It's too small. Even if you are get hired in private hospital, so you may get around $300 per month. Even with that, you couldn't afford the living cost of Ethiopia, so it's hard to live with this amount of payments. So you don't have choice, another choice. So but in believing that we are like giving a service to our peoples, our poor peoples like us, so we proud and we may got some satisfaction from our people. So but we don't have such hope for being like taking payment from government, because it's too low and it's too inaffordable to live with such amount of payment. So maybe in the future I have one ideas. I am going to create like a huge Telegram groups. I am going to call Mailink Ethiopia. So Mailink Ethiopia, it may have a group of people's members around 1,000 to 12 from. I am keeping my goal to make above 100,000 group of members. So healthcare worker of this country may able to work by themselves without any intermediate from different agency. Different agencies are currently taking commissions from healthcare professionals by giving them some jobs. So by networking them with some clients with private organizations or private hospitals or some individuals from the community, maybe from the community or some private health organization. So I'm going to start this Telegram group first, and then I will arrange a group on TikTok. So our healthcare professionals are taking or to take their lead to giving a service for their community without any intermediate agencies in between them, in between the community and the healthcare providers. So they may get some, like they may get some payments by reducing the those agencies those agencies those they can take, they can take money from healthcare providers to give them any jobs. And also there is a different opportunity to work for healthcare providers in marketing, especially healthcare device marketing. So most of the most of the markets are like leads by uh, investors or any others individuals without any health background. So we will manage this growth for to have a good interpersonal networking for our healthcare providers within us and within the community. So creating good networking, creating a good networking between healthcare providers may help in creating good network between the community and the health workers. So I think we may do it. So in the willing of God, we can make it to happen. So I'll say thank you. So don't be get bored by seeing what you are receiving from the government and what others are living near you or beyond you. So that can't make you bored or angry. So we should work together. So we should organize ourselves. We should make ourselves so hard reachable. So thank you for taking your time to hear me. So we may have some meetings in the future with you guys. Have a good times. Bye bye. Enjoy your time. So